recording. Let's go ahead and start doing that. Thank you. All right, welcome folks. And again, let's just make sure, let these last few folks get in. Okay, welcome. Matt Haynes here, Special Finance Projects Manager with the Department of Healthcare Policy and Financing, here with our friends and colleagues from the Public Consulting Group team. This is the Nursing Facilities Pay for Performance Program application trainings and primarily your portal training. This is going to really give you the details, the step-by-step guide on how to submit your P4P application. We got some new enhancements this year, so even if you're an old hat at this, it's good to always attend, and it's particularly important if this is your first time. So thank you for joining. Looking at our agenda, we're just going to have some brief introductions. I do want to talk about some major programmatic changes that are impacting the kind of the program at a high level that are important for you to know about. And then we'll dive into the individual application changes, the changes that are actually in the application and particular measures. That'll wrap up our changes part of this training today, and then we'll dive into the portal training. That'll be broken up into two pieces, as you may be familiar with previous years. We're going to start with a walkthrough of how to use the portal and submit your application. That's going to be more screenshots and really walking you through that. But once we get through there, then we're going to pivot and actually do a live demo, show you how to utilize the data collection tool and the application portal in real time, kind of live. So excited for that. And then we'll wrap up just with some guidance on how you can always reach out for technical assistance. Again, the Pay for Performance program is administered by the Department of Healthcare Policy and Financing. It's really a supplemental payment part of the provider fee program for nursing homes in the state of Colorado. But this is one where reimbursement is based on the achievement of your performance measures in the application. And we consist of quality of life as well as quality of care measures. For 2024, we've continued to remove language specific to the pandemic throughout the application, except for things that needed to be sustained, and to reincorporate our quality metric components. There have been some major changes to reimbursement and prerequisite requirements that will impact this application. I'm going to talk about those next. And then we'll go into the details of the individual changes to the measures. What are those major program changes? Two pieces I want you to really be aware of. With the passage of House Bill 23-1228, titled Nursing Facility Reimbursement Rate Setting, the per diem add-ons that you see in your appendix in your application, generally it's been $1, $2, $3, $4 per day per diem add-ons, depending on where you score in the program. Those are going to change. We don't know what those are just yet because of the nature of the changes as a result of this House bill. The important thing to understand here that's really great for this program is that, as you see the language here, beginning July 1st, 2024, the payment must not be less than 12% of total provider fee payments and must be adjusted for fiscal year 24-25 and 25-26. Whoa, what does that mean? Essentially, what it means is the total provider fee payments amounts that we've historically had for P4P, if we look at what we've paid in P4P as a percentage of total provider fee payments, have roughly been about 6%. So what that means is the pay for performance payment is doubling. Now, it may not be exact because it's a different calculation here, but that moving to 12%, not be less than 12%, means that the total reimbursement for the pay for performance program will now be double what it was in the past. So exciting news there. So where it's $1, $2, $3, $4 now, those numbers are going to change. With this particular must not be less than 12% of total. We have to get that total, determine a bucket of money, and then solve for those different X, 1X, 2X, 3X, 4X. But you can roughly think that it'll probably be somewhere between 2, 3, 2, 4, 6, 8. But we don't know that until we see where everyone lands on the scores, etc. What's important here is it says beginning July 1, 2024. The application you will be completing between now and the end of February, that information, those scores, are used to populate the model that is used to calculate the payment that will be for July 1, 2024 through June 30th, 2025. So this will apply. How you score on this particular application you'll be completing now will result in additional reimbursement under this House Bill 23-1228. Richard, before I move on for here, anything that you would add here for the folks on the line?
No, I think you covered it pretty well. You should be expecting that this payment will roughly double. We'll have the specifics for those regulations proposed here probably around February, March, so that we can get the specific details of how that'll work. But I think in the broad scheme of things, as Matt's explained, is what you should be able to expect. If you're new to the program, this is the year to apply, though, because the payments will be roughly double.
Yeah, absolutely. Thanks, Richard. There's also a secondary piece that's important for you all to be aware of for this year. In years past, you probably are familiar with this table that you see down below. It says severity of deficiency, scope of deficiency, and determination of substandard quality of care. Historically in this program, any home that received a tag in 483.12 tags F600 through F610, quality of life tags F675 through F680, or quality of care tags F684 through F700, and they were at the severity of J, K, H, L, I, or F, that home would have been prohibited from participating in the Pay for Performance program if those were received in the calendar year prior to submitting this application, so calendar year 2023. We have made a change. Along with this increased reimbursement that's coming through, and knowing that civil monetary penalties and things have really increased and become, have more meat into those as well, the department working with the committee has agreed to make a change here that now any Medicaid home will be eligible still to participate in the Pay for Performance program, even if you have one of these tags. So the tags still stay relevant. The F600 to 610, 675 to 680, 684 to 700, J, K, H, L, I, and F all remain relevant. You will just no longer be prohibited for participating in the program. We encourage you to apply. You can still apply and still participate in the program. Instead of being prohibited, now the impact will be the home that has one of these tags within these severity of deficiencies will receive half of their calculated payment. So essentially, with doubling our total amount of reimbursement under this program, that homes that had this would have a much larger hit to their reimbursement then. So with this change, you're essentially able to receive a payment in line with what the historical payments for this program have been, but we'll be missing out on the additional reimbursement. But you will no longer be prohibited from participating in the program. So when you look and say, did I have a tag in 2023 that's in this range? Still apply. Still apply. You'll still receive dollars, but it will impact your payment at the end of the day. Where we are assisting here, because we know this is new, is our team is reviewing these tags. We're able to see that data. There's a bit of a lag for us in terms of what we're able to see. I think right now we're able to see through the end of September. Any home that we see that had a tag in these ranges, we have already reached out to you all and said, hey, I know in the past you would have been prohibited from participating, but you can participate this year. Please do. We're also going to send a mass communication out to everyone saying you can still participate. That would have went out here recently. So just underscore, capital letters, bold. You can participate even if you have a tag now in the Pay for Performance program. It will impact your payment, but it doesn't prohibit you from participating in the program. So please still apply. Before I head into application changes, any questions around either of those two major program changes? And team, anything come in the chat there?
Not yet.
Okay. Well, let's dive into the actual changes in the application you need to be aware of for 2024. One thing, it seems kind of simple, but we want to make sure, especially if you've been having record keeping kind of internally throughout the year, which we know a lot of you do, is that the numbering has changed a little bit in terms of which measures which number. That we've retired the QAPI measure for 2024, and that was measure 9 within the application. So as a result, all remaining measures in the program now have their numbering moved up 1, right? So where consistent assignments was measure 10, now it's measure 9. Where we had 25 measures, behavioral health is now measure 24, and we only have 24 measures. So if you've been kind of keeping it, record keeping based on measured numbers, double check that, make sure you get that, make sure that's clear for you. Those numbers have changed. Now I want to dive into where we got some substantive changes within measures. We only had a few measures where we actually had changes to content, minimum requirement, substance within those. Those are measures 13, the equity measure, measure 17, our quality measures, which is an update we do every year. Measure 19, antibiotic stewardship, infection prevention and control. And measure 20, the Medicaid occupancy average, which we have an update with every year. So what changes did we have under the equity measure? Well, measure 13 has now been broken out into 2 subsections. Initiatives is the first section, and the second section is accessibility. So measure 13.1.1 through 13.1.3 are all covering the initiatives, and that is now worth 4 points. This is a really important measure for us in the program. So you see we have 6 total points here with it. Accessibility is a new piece, so it's a little bit lower point value, but still really important. That'll be measures 13.2.1 and 13.2.2, focused on accessibility. So what do we mean by that? So at 13.1, we've really had what we've had in place over the last year. We've added a new piece here at the top. And it is that you need to submit your home's written public-facing statement from leadership that supports and prioritizes the implementation and/or administration of a program improving health disparities by ensuring equitable care is provided to all patients. Additionally, please submit the location of your home's public-facing statement. For example, it's on our website. Give us that URL of the web page and the exact place where that is on your website, or it's posted at the front desk. Give us some documentation around that. The other pieces you see here are the pieces that have been in place. What areas do you have training on? We'll have some radio buttons around that, so you'll be able to select the areas where you have done training, and then also just evidence of your home's initiative to increase equity awareness and sensitivity for residents and staff. That includes documentation of the initiative's activities throughout the year. So that's a little bit of a newer piece for us there. We've talked about what are your initiatives before. Now, remind us of those initiatives again, but also tell us what you did. Did they have any activity over the year? Now, as we get to 13.2, now we're into the accessibility piece. So we need a narrative from the homes describing how you're ensuring that communications with residents about their medical care in languages other than English meet non-English language proficiency requirements. This can include methods and services such as electronic translation services, language line, iPads, certified interpreters, and language proficiency assessments of staff who are communicating with patients regarding their medical care. Really pulling this straight from the Office of Civil Rights and some of the other major initiatives we see from CMS and some other areas around communications with patients in languages other than English. Also in the accessibility piece, you're going to be asked at 3.2.2 to provide a narrative around your home's plan for ensuring appropriate auxiliary aids and or services are provided to individuals with a record of or regarded as living with a communications disability. So this is different than the first half is those that are using a language other than English. But now we're talking about those with a communications disability. You'll have 4 bullets here. You may or may not have residents that are in each of these 4 categories, but you do need to have a plan in the event that you did have a resident in any of these 4 categories. So what auxiliary aids or services do you have for individuals who are deaf or hard of hearing? What are auxiliary aids services for individuals living with speech deficits? What auxiliary aids and services for individuals living with vision impairments? And auxiliary aids and services for individuals living with manual impairments. And these are folks that have difficulty actually communicating through speech. So that's your folks who need to be using computers, alphabet boards, communication boards, etc. And then finally, you'll need to provide a specific example of how this was done for one of your residents. We know that in these 4, not for each of the 4 categories, just for one resident that's in any of these categories. We know that every home is going to have a resident in at least one of these categories. Measure 17, under our nationally reported quality measure scores, this is something we update every year. So we have to look at the most current data to determine what the 25th, 30th, 40th, and 50th percentiles are. We've adjusted those, updated that. You'll see it in the application, and you'll see it within the portal as well. You can see those highlighted here on the slide. Those ranges have been updated. Also, just remember that the max for each quality measure is 4 points, with a total of 20 points for this measure. So it's a big measure for us. Under our antibiotic stewardship, infection prevention and control measure, there's a big change here kind of structurally from what you need to work on from CDC. So the CDC has published an updated version of the infection prevention and control assessment tool. So the measure now requires homes to complete and submit all sections pertaining to long-term care facilities in sections 1 and modules 1 through 10 of the CDC infection control and assessment response tool. This is still worth 5 points. We crosswalk these and realize that actually, even though they've broke it up into, it seems like more, I think we had like 3 sections before that we were asking for folks to do, is that there was a whole lot in each one of those sections, and it was kind of really cumbersome. They've done a really good job of breaking this out a little bit more manageably. And as we looked at it, the workload, the administrative lift appears to be about the same. There's a little bit more pages that you'll see in there, but a lot of that's more information and instruction pages. So as you can see here, Section 1 previously was facility demographics. Section 2 was infection control program and infrastructure. And Section 3 was direct observation and facility practices. It said it was optional for CDC, but it was required for the pay for performance program. What you see now, training, audits, and feedback is module 1. Hand hygiene is module 2. Transmissions-based precautions, module 3. Environmental services, module 4. High-level disinfection and sterilization, module 5. Injection safety, module 6. Point of care, module 7. Wound care, module 8. Module 9 is healthcare laundry. Module 10 is antibiotic stewardship. A lot of those that are all broken out were all captured under Section 2, infection control program and infrastructure previously. But you do need to complete the whole tool for the measure now in all these modules. Probably a little bit easier to manage and navigate now. At least we have, that's our understanding. With measure 20, under our Medicaid occupancy average, the measure remains unchanged, but we do have to update the statewide average each year. So the statewide average is 64.73% from the previous year. And so Medicaid occupancy of 10% or more above the statewide average would be 71.2% or higher in order to get 4 points in this measure. And in order to get 3 points is your Medicaid occupancy between 5% and 10%. So between 67.97 and 71.2%. Again, that's a yearly update we do for every application. Okay, before we move into portal training, any questions on the changes to the content and the minimum requirements within the application that we can help answer? I see a question. We will be sending out the slides to all of our P4P contacts after the training, and we're also recording this training and it'll be made available on our website. Okay, well, with that, I will hand the floor over to my friends and colleagues with Public Consulting Group, who are going to walk you through the portal piece and how to actually submit this application. Team, the floor is yours.
Perfect, thank you, Matt. And just want to confirm that everyone can see the screen okay?
Yep.
Okay, great. So like Matt mentioned, in this section, we will be going through the mechanics of actually navigating the 2024 portal, submitting your application, adding new users, everything that you're going to need to know in terms of the 2024 portal. So for the agenda for this, we're going to show you all how to log in, how to navigate the homepage, facility information management and user management is where homes can add new users to a specific homes account, all of that. The participant completion summary and the performance measure pages are places where you can track your application progress visually, as well as we'll show you the appendices and tools and how they look in the portal, as well as the file upload, where you're actually going to be uploading your documentation for each measure. And then the confirmation and submission page and how to navigate that is just an important part that we want to make sure that we're covering. And then following this, we'll have, like Matt also mentioned, our live portal demo, where we'll actually demonstrate how to log in, navigate, complete an application, etc. So for logging in, this is the website. It's the same website year to year. If you have existing portal credentials, those will carry over for 2024. If you're a new user, and this is your first time logging in, what it'll bring you to first will be updating your password and security questions upon initial login. Pretty straightforward. You just see there's the 3 security questions there, along with the update security info button that you have to hit after you've set those up. And then once you've done that, you can hit continue to navigate to the home page. And this is going to be where the whole portal, the whole application lives digitally. So the fiscal year, obviously, for this year is 2024. Please make sure that you're selecting the 2024 option from the drop-down. And then for the first time login, this is the prerequisites page. So the prerequisites page is only really meant to be completed one time. This is where the resident and family satisfaction survey attestation is. So that must be selected yes and meet the specific criteria. The information in terms of uploading a summary report that identifies the vendor completing the survey and the home's survey results. That's just something we really want to emphasize. Without that piece of the prerequisite data, we can't score your home's application. So just making sure to call attention to those aspects of the prerequisite page. Once those are filled out, it'll bring you to the main homepage, and this will be the main landing page for all subsequent logins. So this homepage is where obviously you can see the fiscal year 2024. You'll be able to select your facility that you're working on from that step 2 drop down, and then you're going to see the facility information management button, the user management button, participant completion summary button, confirmation submission button. And just to note, this button will appear once all the measures in the application have been completed. So if you have measures that haven't been addressed, you won't be able to see this confirmation submission option. So once you do see it and you're able to complete your application, you can also see the view reports button at the very bottom, and this is primarily how on the reviewer side and the scoring side, we're going in and tracking application progress across the group. But this is it's also where you can track your individual progress for your home as well. And we'll get into more in terms of the additional portal. The participant completion summary page has a really good visual aids for helping you keep track of where your applications, where it is, and your progress.
Hey, Charlotte, this is Matt.
Yes.
Apologize to interrupt, but can we just go back 2 slides for 1 second? I want to make sure
Yes.
I hit something for folks.
Yes.
So on the prerequisites page, we are asking you for your average daily census for calendar year 2023. If you're a go-getter and you're in there this week or here in December trying to fill this out, and you're like, well, I'm not going to know 100% my average daily census till I get to January, right? Because it's for the entire calendar year. It's okay. Take the average daily census you have for every day is up to the day that you are completing the application. I don't want you to feel like you have to wait till January to log in and do this because of this piece. So we, historically, we do not see daily censuses, change within the last 10 days of December that are going to change your average daily census in any statistically significant way. So don't feel like you have to wait. You can go in there, just give us the average for every day you got up to the day you're completing the application in 2023.
Yes, thank you, Matt. That's a really good point. Any other comments, questions?
No, I think we're going to hit on the user management coming up. Is that correct, or did we already? Okay.
Nope, that's coming up. Yeah.
Great.
So facility information management. So this is where you can update, if need be, your home's name, PFID, Medicaid ID. But this actually, I'm sorry, we on the PCG side have to be updating those specific data fields. So for your home, you'll be able to update contact information, all of that. But just please click update participant information. So it's that button highlighted red right there to save your information once you have made any edits. That's just, it's an important thing to note. And then similarly for user management, so this is where homes have the ability to add additional users to homes if that is a necessity. So we do encourage all homes to grant more than one user access to the portal. There's a couple reasons for this. I think primarily we really want to drive home that for any administrators who are who might be leaving a given home and are the primary portal user, we just ask that you please add the appropriate person who's going to take your place in terms of being the application submitter prior to your departure from that home. Just, to ensure continuity between users in our account, in our portal for your home, and to really just make sure that we're following the best practice of having 2 users minimum added to a home at a time. And just to make sure that if in the event that you do depart from your home, that your remaining team is added and has the necessary access to go in after you. So on the user management page, you click add new user from the select user dropdown. You enter whatever that folks name is, contact info, and then assign them just the temporary password of P4P lowercase everything 2024. And then choose the home or homes that user should have access to. And just like we mentioned on the facility page, make sure you're hitting that add new user button down here on the bottom left in red. Otherwise, it just won't save. So just highlighting that.
Yeah, that's great, Charlotte. This is Matt. I just want to really underscore this and make sure I can follow as well. So if we went back to slide 28 here, is that how I get, so from facility information management, I have to hit update participant information. That just saves my address or phone number, or is that also how I get to this next page?
No, so this will just save once you hit update participant information, that'll just save the facility information inputs right there. This is a separate, and I can actually go back to the main page, or Gretchen maybe when she's demoing can show us, but this the user management is just on the main page. It's the button right underneath facility information.
That's great. So remember this page, folks. So yeah, we can go back to slide 29 here. I really want to underscore this. We get a lot of requests kind of each year around this time, folks saying, hey, I need access to the portal so I can submit my P4P application. If you are a current administrator or you currently have portal access, please know that you are able to add others that need to be working on this, or that if you have delegated other responsibilities around completing the application and other folks need access to be able to go in here and complete this, you actually can provide that access without having to reach out to the department or to PCG. You have control here. And Charlotte hit on something really, really important I want to definitely underscore. Change happens, turnover happens, folks leave. We've had some nightmare scenarios where the one and only person who had an account at a home left. They either went somewhere else, they retired, explored new career opportunity, and then a new person comes in and goes, I don't know anything about this portal. I don't know how to get access to it. As Charlotte hit there, make sure you have 2 folks, at least 2 folks that have access here. So if someone, and the other one that's the nightmare scenarios, we went through COVID, right? And we had these applications due, and someone said, the person who was the only person who had access and who was in charge of loading the application got COVID and was out and wasn't able to be back before the deadline and didn't get it submitted, and no one else at the home was able to get in and do anything. So even if you're just sick or you're out of the office temporarily, you want to be able to make sure that your home has access to complete this application. And in the event that someone does turn over, you've got another person there. And if you have new staff that need to have access, you actually are in control. You can add them. So please get familiar with this. Make sure you understand how to manage your users and make sure that you do have multiple folks with access so that you have continuity of operations and you're covered in the event of any unforeseen circumstances.
Definitely. That was really well put. And that's exactly what we just emphasized. That just puts you guys in the best spot for just covering your bases as you're applying. So.
And Annie has a question here of where exactly is the user management link on the site? And I think we can do that in the live demo, but I think you're about to go back a few slides and show us the main page there where folks
Oh,
can get here.
yes. Yeah, so this is what the main page looks like again. So it's you'll see the facility information management's the first one, user management. That's where you're actually going to be adding specific folks to your individual homes. And then Gretchen, when she demos, she can kind of show a live how that actually is going to look. But yeah, like Matt said, everything that you really need in terms of navigation pages are all right here on this homepage.
It's great. Thank you, Charlotte. Yep. Big button there, user management.
Any other, Matt, any other things to add on user management, facility management?
Nope, that's it. Thank you for that. Just, yeah, folks, please remember about this. Just take care. Make sure that you cover yourself.
Yes. Absolutely. Okay, so then performance measure pages. These are the actual within each measure of the application. We have our individual minimum requirements that make up the components of that individual measure. So you'll see here, measure 1 is screenshotted over on the left. It has 7 corresponding minimum requirements that must be addressed from these drop downs for your application to be submitted. So users have the option to select yes, no, or not applying for each of these drop downs. Selecting yes serves as confirmation that the applicant has reviewed all minimum requirements and that the criteria has been met. Selecting no or not applying serves as an acknowledgement that the facility does not meet the criteria or does not intend to apply for points in this measure. So that's just something that we just really want to emphasize is if you are intending to apply yes for that measure, the corresponding minimum requirements need to be checked off yes, and the documentation needs to be uploaded properly. And we'll get more into documentation as we in a few slides here. So like I said, yes, for each minimum requirement, and the drop downs will award points to a home self score over on the right, screenshotted up on that right hand corner. So once all minimum requirements have been selected as yes, a self score will auto populate, and it won't auto populate if there are any minimum requirements that have not been selected as yes. And then just some important buttons to just highlight down here on the bottom, screenshotted in red. Please just remember to hit save when you're done working on a specific measure page. That'll obviously just make sure to save your progress. The other way you can do that is to hit next and previous. Those should you can save your progress by hitting either of these, any of these, but just please make sure that you're saving as you go through. And hitting summary at the bottom of the page here will get you back to the main participant completion summary page. And then click any buttons that moves to a next page. Like I said, will save your progress. And this includes links in the navigation bar at the top of the page. And this gets into the actual performance summary page itself. So this is where you can really see a visualized measure by measure breakdown of your application progress. So you can see that prerequisites are up at the top, and then the 2 different domains that we have, quality of life and quality of care, are underneath. The row color key, this is our how we just track participant completion summary. So you'll see up at the top, screenshotted in red, there's 4 statuses. So blue means that still needs a self score. Green means needs a reviewer score. Orange means reviewed, and then gray is excluded, not applying. So that would really only be applicable for the QMs. The row color key is just can be used to easily identify the progress of each measure in the application. So as you're going through and completing measures, they'll light up orange instead of blue. And so just a kind of a helpful way to visually track where you are. And then the total scores will populate as you work through the application. And this is this documentation color-coded key is new this year. We added it just as a visual aid, an additional visual aid for homes to just kind of help you keep track of where your documentation is in terms of status. So you'll see that we have three. So the black and white check mark box means documentation is complete. That's set. You don't need to do anything else. You've satisfied your documentation requirement for that measure. Red means still needs documentation. So over on that far right column, those circles will light up red and just flag that for you that specific measure is still needing the corresponding documentation. So just helps you keep track of things a little bit better. And then blue, a blue dot means the documentation is not required.
Yeah, and this is Matt. If we could just go back there for a second. This is like, I'm really excited about this update, folks. Mm-hmm. Previously, we had useful information. It just said you had kind of the checkbox, and that just let you know that there was documentation required for that particular measure versus mm-hmm. measures that did not, which was helpful. But now it's more dynamic. So it's going to mm-hmm. not only let you know if documentation is required, see blue is, oh, don't have to worry about that. No supplemental documentation is required. But now with the red versus the black and white checkbox, if it's red, it means there is documentation required, and I haven't uploaded anything yet. So we got the system mm-hmm. to actually talk to your upload to know that. So this is a really important piece as you go back and do your review, because we do every year, we have our preliminary review, but most of the time our findings in preliminary review are, you said you met the measure, but no documentation was uploaded, right? Mm-hmm. So this should be able to help you with that. So kudos to the team for being able to build this out. This is a really exciting new feature.
Yeah, exactly. And then just looking over at appendices and tools, we also have just that column that tracks and notates if there are appendices or tools associated with a performance measure. So that's just one additional visual.
Yeah, and now this one, folks, is not going to tell you whether you've completed the tool or not. So right. The uploads we're able to talk to, and we're able to build that out. With this one, it's just telling you there is an appendix or a tool. Some appendices don't need to be filled out, right? It's a reference. But this just lets you know where they are. Now, it's important for you to know that if it's a tool, it's required for you to complete that tool. So this is still helpful information, kind of like what we had previously with the documentation. Any measure where you see a checkbox and a square here, you need to make sure that you're checking to see if there's a tool there and that you've completed it. Mm-hmm. We'll be exploring if we can make this as dynamic as the other one going forward, but for this year, this is information for you to then make sure that you go in and make sure you complete those tools.
Exactly. So like I was saying, this is just getting a little bit more into the nuts and bolts of the appendices and the tools. So if a performance measure, like Matt said, does have an appendix or tool associated with it, it can be accessed on the right side of the measure page. So over on that right-hand column under appendix forms. And then tools similarly are forms that require the user to enter the data. So that is where you see circled in red, the QM calculation tool, for example, the tools will always be right underneath appendices over on the right-hand side. So we really do encourage, in more than that, we really require that an associated tool has been completed for that specific measure. This is really just best practices across the board to make sure that we're reviewing, it's capturing your home's data properly, that we're scoring and reviewing your data properly. Just really, I think, makes things a lot easier. So that's just something to really emphasize in terms of using measure tools.
Yeah, thanks, Charlotte.
Not-
And folks, here's where our check is in the system, right? If you have a checkbox on that appendices of tools, and you feel like you went and answered yes, and you felt like you completed the measure, but you do not see a self score in your self scores, that means you did not complete the tool. So that's where the check is. So remember, well, I may have misspoken there. So our system may award a self score, won't it? It will, Charlotte. So you actually will see a self score there, but we will not award you any points if you have not completed the tool. So again, just make sure if you see tools on your measure, you see that checkbox on the summary page, complete the tool, fill it in. It's a two-part process. You can't just answer yes on the measure here and do an upload necessarily, even if there's an upload required. You have to complete the tool as well.
Thank you. And then the file upload, this is where you're actually going to click to submit supporting documentation for a specific minimum requirement. So you'll see the file upload button that you click on is circled in red. Please make sure that your pop-up blocker is disabled when you're clicking on file upload. We've had folks report in the past that their browser or their pop-up blocker wasn't disabled and was causing them problems with the file upload page specifically. So just something to flag there. Just make sure that that is the case on the specific browser that you're using. And then just something to note also, you can upload multiple files at once, but each file has to be associated with the same performance measure or minimum requirement and must have the same associated notes. So this is just a screenshotted example of how you would actually go through and upload. So you'll see the performance measure as the first drop down. You want to select that and make sure that it pertains to the right performance measure that you're working on. Same for the minimum requirement right underneath it. That's the second drop down. You want to make sure that within the measure that you're working on, that you said there's sometimes 5, 6, 7 minimum requirements. Please make sure that you're just selecting the right one for uploading your data. Then you're going to, underneath that, you're going to choose files. And then if there are any notes, you can input them there. They're not required. And then you're going to click upload document to complete your data submission. And also just something to underscore, to avoid potential loss of points. Please make sure that all supporting documentation is tagged the appropriate measure and minimum requirement. And that's just something we like to sound a little bit like a broken record about, just as it's all in the service of making sure that your documentation is as organized as possible for review, and to make sure that we, when we're going through, we're not awarding points based on documentation not being there. If it is there, you really want to make sure it's in the right place. So
yeah, thank you, Charlotte. I really want to underscore this, folks. I'll be a little bit more blunt. Charlotte and team are so kind. I do not want our review teams to have to go on a treasure hunt, right? You want to make sure that you do not leave any doubt in the reviewer's mind or have to search or figure something out about your documentation, because that just creates risk where we're going to miss something or not see something and you won't be awarded points. This is your spot to make sure you do that. One, make sure it's tagged with the appropriate measure. Make sure it's the appropriate minimum requirement. But then those associated notes are really nice, right? That's your spot to go. In this document, specifically, you know, on page 3 is where I detail the policy and procedure, whatever it may be, where I've circled the areas that you need to focus on. Make sure that you use those notes. So imagine that, you know, a reviewer is taking an objective look, that you leave no doubt about that you've met that measure and that that documentation is there. This is your opportunity to do that, and I strongly endorse that we, you know, we do not want our teams having to go on treasure hunts to try to prove that you've met the measure.
100%.
We have a question that came in that said, are
Yes.
additional titles necessary when uploading documentation? Katie, I think I'm following that, but if I don't, please clarify for me. If you're uploading your documentation, what's really nice about this system is by selecting the performance measure and selecting the minimum requirement, our system gets discrete data that tags your documentation to that. So you don't necessarily, like, if it's testimonials, you don't have to say measure 13, give the title of the measure, minimum requirement 13.2.2 testimonials in the title of your document. If it's testimonials for whatever the measure is and you title it that way so you know what it is and which measure it is, you're fine. But it really helps to make sure that, excuse me, if your titles can relate in some way to the measure that you're applying for, it always helps. But what's really great is to make sure you hit those drop downs and tag it to the appropriate measure minimum requirement.
Great. And then just also focusing on file uploading. So a confirmation message will appear when an upload was complete. So you'll get a nice little confirmation that it was successful. The uploaded file with associated info will appear under documents on the file upload window within the performance measure to which the document is tagged. So you can click edit to edit the performance measure or the minimum requirement or the notes denotion for that specific document. And you can also click delete to just delete the uploaded document if you posted the wrong one or if you just made a mistake in any way. So that's just important to note. And then also users just can't upload multiple files with the same name. So that's just something to keep in mind for measures with a lot of minimum requirements. If you're having documentation that pertains to different minimum requirements that you need to upload, just make sure that you please, if it's minimum requirement 1.1, you name your document what enhanced dining measure 1, denoting that it pertains to minimum requirement 1.1. So that's just something kind of like granular nuts and bolts thing we emphasize.
Yeah, and this is really, really important, folks, between measure 17 and measure 20, right? Because you have Casper reports required for both of those. So if the title of your document is just Casper reports on both, you're not going to be able to upload that again. So it's as Erica was saying here in the chat, and as Charlotte was addressing just now, is that since we do have Casper reports for 2 different measures, you want to title the even if it's the same document, create 2 versions of it. One is Casper report measure 17, Casper report measure 20.
Exactly. And then when changing the performance measure minimum requirement or notes field, like I said, you just click edit to save your changes down at the bottom right there. And then just getting into the naming requirements for documents. So we just like to specify that it is a requirement that all supporting documentation is well organized, clearly labeled, and easy to navigate through. And this is really for the reason that Matt was just describing. It's just so that we can stay as organized as possible when we receive your documentation and when we're reviewing it, because that's really what's going to be that's important for us scoring your application properly. So we really ask that you're cognizant about how you're naming your supporting documentation. So recommendation for a best practice in uploading documentation is to use the following naming format. So the measure ID, using measure one as an example, measure one, enhanced dining would be that second part of it. So measure one, measure ID underscore measure name, and then lastly, the document description. And each measure has a corresponding measure ID in the system. This can be found on the participant completion summary page, as well as each individual measure page. And please just include a leading 0 for measures 1 through 9. So if you're working on measure 1, enhanced dining, you would just denote a 0 and then a 1 in front of the measure. And then in terms of document description, a brief description of the documentation being uploaded. This description should tie to a minimum requirement. And also, like Matt had said, additional details can be included in the associated notes field to provide more clarity on each document. And we really encourage that and welcome as much context and detail as you can provide us on your supporting documentation, the better. So, and then just at the bottom, we have examples of files following this naming format. So enhanced dining, measure 1, you see that 01 in front, underscore enhanced dining is the name of the measure, and then underscore menu cycle being the name of the document. Matt, anything, I'll pause there, anything that you would add or any questions about document naming?
Yeah, folks, this is really best practice. Despite our drop downs and minimum requirements and things that we had there that help tag documents to a measure, things happen. And we know that folks will grab a document and think it's one document and think it's another and tag it to a minimum requirement. This helps you, it also helps us, because then not only are you selecting the minimum requirement and the measure and the minimum requirement in the drop downs, but the name of your document matches, so there's no chance of you pulling the wrong document. You're going to have it really well organized. And in the event that things happen with mouses and clicks and selecting documents out of one library and pulling it into a portal, I get it, where our team can look, and if under measure 3, something that was tagged on measure 3 or a different minimum requirement, and we see that the title of the document was 01 enhanced dining menu cycle, we know that that really meant to go somewhere else and that someone uploaded an incorrect piece of documentation there. That helps us to be able to, it helps us in our preliminary reviews. It helps us to be able to help support you to get it corrected so you don't lose any points from that. So best practice here, really support you following this in addition to using your drop downs.
And then just lastly, confirmation and submission. So this was the button that I had mentioned will only appear once all measures have been completed in the application. So you won't see this fourth button on the homepage until that point. And then once you do see it, you can click on the confirmation button to access the confirmation submission page. This is the screenshot at the bottom is what that page is going to look like. So you can just enter your name, read the text under the provider signature and submission box, enter your name and title in the attestation box, check the confirmation box to certify that all the info that you've submitted in your application is complete and accurate. Click submit. And then once you click submit, you will receive an email, an automated email from the portal indicating that your application has been submitted. So that's something that we added in with our development team this year to just make sure that homes are receiving that confirmation email, letting them know that their application is submitted. So if you don't receive that email, please reach out to us because you should be once you hit submit. And also important.
Charlotte,
Yeah, go ahead.
I'm sorry. Just let us know here. like the confirmation box is not huge, right? We don't have it kind of in red here, but it's down there at the bottom underneath title. You've got to make sure you pay attention to that. Let's say a home filled in the name and the title and didn't select that confirmation box. Would they be able to hit submit, or would it not let them continue forward?
No, I think, and Gretchen, we can just show this in the demo. I don't
Yeah,
think
well,
it
let's
would
do
let
it. Yep.
them. Yeah. But it won't let you move forward until until these two boxes have been filled out.
That's great. I mean, we have some of those checks built in place, folks, but we know we've had some folks outreach and go, it's broken. I'm trying to hit submit and I can't submit it.
Yeah.
And it's a little small box down there, but you do have to hit that confirmation check box as well.
Yeah, no, that's a really good point. And we also just note that once submitted, the application is locked and you will not be able to make any further changes to it. So we just emphasize that that you really prior to hitting submit and filling out this page, that you do just double, triple check to make sure that everything is included and submitted. I'll pause there actually about Matt, if you have any additional comments on confirmation submission, if there's any questions in the chat, I'll just pause there.
Yeah, that was great, Charlotte. I think that was a really important note for folks to take home is, one, don't be completing this on February 28th. Actually, you got
Yes.
till the 29th this year. It's a leap year. You get the extra year for application. Don't be completing it on the 29th. Get it done early. Make sure you have time to go back and make sure all your documentation was uploaded, because you can see it. You'll have a list there. Does it match? Did I upload it to the right measure, the right minimum requirement? That way you give yourself time to review and then you can submit. And that way, even if you do submit, I mean, it's locked. But if you submit this thing on January 22nd and then 3 days later, your staff member comes in and goes, oh my goodness, I gave you this document and you uploaded it and we uploaded it to that minimum requirement for that measure. I gave you the wrong document. Even though I titled it this, it's the wrong one. I looked at the wrong piece of data, whatever it may be. You still have until the 29th. So you can reach out to us and go, hey, we need this thing unlocked. We had a piece of a documentation that got labeled incorrectly. It's the wrong document. We can unlock that and let you back in there and let you be able to complete that. But only if you're ahead of time, right? It doesn't do you any good if you submit on February 29th and 3 days later your staff member goes, oh crap, I just realized I gave you the wrong document and that really wasn't the one for measure 3. Well, now you're past the deadline. There's nothing we can do.
Yeah.
So
No,
early and often, get that review in before you hit submit if you can. But then once you're submitted, try to submit ahead of time, because we can always help if something does come up.
Yeah, no, exactly. We would echo that times 2, times 3 on the PCG side. So, okay. Any questions about either, if not about confirmation submission, about just the portal
What?
in
Yeah, I see
general?
Bree has
Yeah,
a
go ahead.
question around
Go ahead,
the
Bree.
naming conventions again. In the past, we've labeled it with the secondary number, for example, 13.2. From the naming recommendation slide you presented, it appears you do not want the secondary number included. Is that correct? It's okay if you do, Bree. We don't mind it there, but it's not required, because the name of your document, like menu cycle or testimonials, will really tell us about the 0.1 or the 0.2 there. And again, you'll be able to select that minimum requirement 13.2 in the drop down box. So this naming convention is kind of best practice. But as long as you're doing something with that's tying it to the measure and the minimum requirement, you'll be okay.
Any other questions in the chat, Matt, Erica?
Nope, I don't
I think
see
we've
any.
addressed all so far.
Okay.
Oh, we just had one just come
Oh.
in.
Oh.
That's the magic word to get another question. That's great. What if we do not meet all the measures? Is there a threshold of when we can't submit for P4P, or do we submit what we have? Our facility is new. Great question, Shandy. The pay for performance program, I know folks have wondered, well, I don't want to score low. It may look like I'm not a high performing program. That's not true. The pay for performance program, everything that's in this application is over and above. So you'll see we award points. I mean, you have to have at least 20 points in order to get some additional per diem add-on. There's kind of a minimum amount you have to kind of get in order to start to get dollars. But if you're at above 20 points, you're getting additional per diems for your home. And what we say is, even if, first year, my home's just trying to get this, we're just getting our, these programs in place in our home, that's great. We want to recognize you for the work you're doing. If you score 25 or 30 or 40 points, you've scored 30 or 40 points over and above in some areas. So it's not a poor reflection. It's a reflection that you went and did things over and above that earned your home additional reimbursement. Don't leave those dollars on the table. So please apply. You got to score over 20 to get any per diem add-ons, but apply, because the other thing about this is this application is designed in such a way, these measures are designed in such a way that allows you to have some really good project management around cultural change and best practices within your home. So building some project management around this program is going to allow you to be able to manage these different types of changes you want to be seeing within the home and cultural best practices. That also builds you a nice infrastructure to be able to demonstrate to your team, to your staff, about the impact that their work is having, and the way to see the types of intentionality around what you're doing to improve the residents' quality of life and quality of care. And then when you receive a payment, you're able to say, hey, team, look at what all this work did for us. It not only in terms of what we're showing in terms of the initiatives themselves, but there was actually dollars that came back to the home. I know it's kind of long-winded, Shandy, but I see you're kind of new to the program. So it doesn't matter if you meet all the measures. This is not a 100% program. If you score between 80 and 100, you are going to get the maximum per diem add-on, because we are striving for folks to really excel in this program. But go get the dollars, go get recognition for the work you're doing.
Absolutely. Any other questions in the chat, Matt and Erica, or is that the end?
I think we're ready for live demo.
Okay, awesome. I will let you steal the screen share, Gretchen.
Great, thank you. Can you all see my screen okay?
Yep.
Okay. So when you first log into the portal, you'll first be directed to this page. You'll want to select the year. Charlotte covered this in one of the first screenshots, but the current application year is 2024. So you'll select choose, and then you'll drop down to select your provider. In some cases, you might have one. In this situation, I have two that I can look at. So we'll do test facility first. And here is kind of that home page that we saw in some of the screenshots. And from here, you can get to anywhere that you need to navigate to. I'll highlight some of the key things first. So we'll want to look at the Facility Information Management tab. If we click into that, we're able to update the facility address. This is really important. If this does change, we recommend that you update this as soon as possible, in case that way in our records, everything matches and we can make sure that we have the correct home. This is especially important with name changes. And again, if the contact phone number changes, please update that here as well. And then when you make changes here, you're just going to want to hit update participant information, and that'll save it. And then you can navigate back to the home page. Another really important tab here is user management. And we really want to stress this. So our best practice recommendation is to have at least 2 contacts for each home in the portal. This is really important if someone is out sick, like Matt had mentioned, or maybe on PTO. This is where we get your emails to email you important information, or if we have a question about something pertaining to your application, this is the email we'll use to reach out. So it's really important that we have up-to-date contact information. So if someone is leaving, we really recommend putting in a new email address while you still have access to the portal. If your ownership changes and now you have a new email address, please go in and update that. So to do so, you'll want to select Add New User, and you'll want to select the facility that this is for, and you'll go in and you'll select Add New User. So here we can go in and put in information for Matt so that he has contact information. We'll put in his PCG email address, and then update, his contact information. We'll put in a phone number. We'll use the temporary password of P4P 2024. And then we'll want to select which facilities he's associated with. So if I have access to both these facilities, maybe he's only, associated with one of those facilities. So we'll just select that one, and then we'll select Add New User. And Matt will receive an email at that email address that we put in, and it'll tell him what his temporary password is, and it'll send him a link to the portal so that he can go ahead and sign in and have access. So I just want to pause there and see if there's any questions that maybe came up in that time. This is really important, and we want to stress that if you have access to a facility in the portal, you can add new users. All right, not hearing any, is that correct?
That's correct.
All righty. So that's the user management. If you go to participant completion summary, you'll be able to see the survey and what step you're on in it. But before we get there, I want to demonstrate what the prerequisites look like when you first open your application. So when you first start your application, you'll be directed to the prerequisites. And this is really important. Here we highlight the change that homes, even if they do have a substandard deficiencies tag, they're still able to participate in the program and receive half of their calculated payment. So there's nothing to acknowledge there, but we do have Appendix 1 linked here for reference. If you want to go ahead and look to see what the table is for those substandard deficiencies. And here we want to, homes will need to attest to their resident family satisfaction survey. And a crucial detail here is that this survey will need to be uploaded or a copy. So I'll detail where you do that afterwards, but this is really important. It is part of the prerequisite requirements. We want to make sure that everyone is uploading a copy of their results of their resident and family staffs or satisfaction survey. So here you'll indicate yes. You'll want to put in some numbers here. And you'll also want to give us some information on who's administering the survey. So we'll want to know if it was done by the vendor staff or the home's internal staff. And if you select other, you will need to indicate some more detail about what that might be. And then we'll also want to know a few details about how it was administered. And again, you can check multiple if it was administered a few different ways. And then down here, this is just some important information that we recommend reading through before you start your application. And then at the bottom, you'll just want to select Submit Prerequisite Answers. And it'll take you to the home page, and now you can access your survey. So an important thing to note here is that the confirmation and submission tab isn't available yet for this provider because they have not completed their survey. So that entails they do not have a self-score for every measure currently. But in this facility, there is a self-score for each measure, so they are able to submit their survey. So we'll go back to the other one. And this is what the summary page looks like. And you can navigate throughout the application on this page. So you'll want to start at the first measure, enhanced dining. And here you will indicate if you meet each of these minimum requirements. So in this case, I'll select yes. And if you don't meet one of these requirements, you would say no, and your self-score would not be there, or your self-score would be 0. And if you're not applying for a measure, you will still need to go in and indicate no or not applying for each measure so that you have a self-score of 0 so that you're able to submit the application. So here you can hit next and this will save it. You can hit save and this will save it. Or you could even go back to the summary page. But in this case, we'll go to next. And the record has been saved. And I want to also highlight how to upload documentation. So here in the file upload, at the top, we're able to indicate what performance measure we're applying for. So we can do enhanced dining. And this is also where you will upload that copy of your family and resident satisfaction survey under prerequisites. So that's really important to note. And you will need to upload a copy of that there with the results. So we'll go to enhanced dining. We'll indicate which minimum requirement it is for. And we'll select choose file. And I will select measure 2 or measure 1.1. It's upload, and then I need to click here. So you can tell here that this is the document that was selected. Oop. I guess I'll do that again. All right, so measure 1.1 was selected, and I need to click upload document for it to be uploaded. It gives me this message. I know it was uploaded. And if I wanted to, I could have also put notes in there and they would have populated there as well. So that's how you upload documentation. If you want to go back to the summary page, you can click summary at the top. And once I've given it myself a self-score, the color of this background changes to green. So that's a good way. Before you're able to submit your application, all of these will need to change to a green color before you're able to submit.
And you'll notice, folks, that Gretchen only uploaded one document for under that measure, and it had multiple minimum requirements that require documentation. So you see the documentation uploaded is still showing red, meaning, oh, I uploaded something, but I didn't complete my work there. I need to go get more documentation uploaded.
Exactly. And it is important to note too, so if for this measure, say I don't meet this requirement about having access to food 24/7, so I'll say no. And then when I save it and I go to the summary page, that changes blue because I indicated that I'm not applying for that measure. So it indicates that documentation is not required. So you basically, depending on what answers you put in to generate your self-score, that indicates what this document upload status is. So that is great. And then if I had uploaded each of these, if I had uploaded documentation to each of the minimum requirements, it would change to a check mark box. And I can show that in the other test facility that I have. There's a few other things that I wanted to show here. So in the quality measures, this is one of the measures that has a tool. And so here, when you complete this, you'll want to first say that you're applying for it. You'll want to use this quality calculation tool to figure out what range you fall in and how you should indicate what your score is. So in this example, I will be looking at my CASPER reports and I'll look at Q3 and Q4 of 2023. And my score for Q3 was 3.2. And then my score for Q4 was 2.2. And then I save and calculate points. And it's indicating that I'm in that 25th percentile. My score is less than 2.75. So when I go here, I'll indicate that it was less. And then I have a self-score of 4 points. If I had been in another range, I would get a self-score of 3 points, or a self-score of 2 points, or a self-score of 1 point. And if it is over 4.71 for this measure, I would indicate that I'm not applying and I would have a self-score of 0. Yes, Matt.
Yeah, thanks for that, Gretchen. I think what Gretchen was hitting on there is really important for you to think about when you're completing the quality measures. Generally speaking, on most of these, you should complete the tool first to see where you land before you kind of respond of whether you've met or not, but sometimes you may just know and you can select a yes or whatever. But this, you actually have to select which quartile you think you're landing in. Well, you don't want to do that first and then do the tool. You want to do the tool first, put in your actual data, then the tool will tell you what to select back on the other page. So that order of operations she just showed you is very important. Get to your tool, complete your data, and have it tell you what then you need to select back on this measure completion page.
Yeah, that's great. And another thing I will go through and do another tool for measure 21 for staff retention. This has a tool as well. So first, this 21.1 says complete and attach the staff retention. So I'll say yes, and then I'll go through and do it. And so for this tool, there's two ways you can get points here. I'll want to enter the total number of individuals on my payroll roster as of or on January 1st, 2023. So in this example, it'll be 50. And then by the end of the year, on December 1st, 31, 2023, there were 25. So my staff retention rate was 50%. This needs to be greater than 60 to get points. So in this case, I wouldn't, but I could also see how it improves year to year. So looking at what my percentage was here, it was 50%. And then last year, maybe it was 40%. So, that improved by 10%, and that's also greater than 5%. So I'm able to get points there. So I can just click save, and I have all that data entered there to use. And then I'd go through and I'd also want to upload a copy of the payroll roster and highlight staff that's hired on or before January 1st. So we'll say yes. And if I didn't qualify for the staff retention, but I was doing a QAPI project related to staff retention in 2023, I could indicate no or not applying. And then I could apply for the QAPI points. So that'll give me a self-score of 1. So these recovery points are the only, so in some cases you don't need to have yes for everything to still get a score. For the QAPI recovery points, you just have to say yes for those questions.
Now, Gretchen, if I had selected yes there on 21.1 and I went and completed the tool, but the tool told me that I didn't meet either one, I completed the tool, so I have a yes there. Can I still have a yes at 21.3, and then how does that work out for me?
Sure. So if you indicate yes for 21 and then 21.3, you would still have the point, the 1 point for the QAPI recovery because you said no for 21-2. But if you say yes for 21-2, it'll change your score to 3. So even if you accidentally indicate that you're applying for the QAPI recovery point, you can't get more than the 3 points. So it's not going to change this 2 score to 4. It'll still be 3 because you're applying for 21 and 22. And then if we went in and reviewed and saw that you did not meet the requirements for 21, but you had applied for 21-3, we could give you that point.
Great. Yeah. So I think, folks, as you're doing this particular measure is an interesting one because we just want you to complete that tool. It's what it says at 21.1. So you're going to say, yeah, I'm going to go complete the tool. But the tool is going to tell you whether you've met the measure or not to receive the full points. You wouldn't necessarily, I mean, you could go back and select no if the tool told you didn't meet it. That's always helpful. But even if you don't, and you're like, well, the tool just told me I didn't meet it, but I do have a QAPI, I'm going to select yes there. Go ahead and select yes, submit your QAPI. It's going to show you a self score of 3 there, but when the team reviews it, they're going to see that you didn't meet that first part in terms of the data, and then it'll be revised to that QAPI recovery point.
Exactly. Yeah, and it's always good to remember that the description for each of the measures is up here at the top. So you could read here and see that, you need to have the 60% retention or improvement. So the details are up there as well, too. And I can go through too now and talk a little bit more about actually submitting the application. So as you can see, I'm still, for this provider, I'm still working on completing my summary, so the confirmation and submission page is not there yet. And we've added language here too, this reminder up here, reminding that a self-score needs to be assigned for each measure in order to submit your documentation. So this part is really, really crucial. So once you do have a self-score for each measure, as I do for this test facility, you'll get this option for the confirmation and submission. So once you've gone through, you look through your summary, you double check all the documentation that you uploaded. Maybe you go in and you look at all of these red dots. In this case, it's kind of a clear example that maybe I need to go through and review some of these red dots. Doesn't look like I've uploaded all the documentation that's necessary. I also haven't uploaded my prerequisite information yet, so I would need to go in and do that. Again, as a reminder, you can find that under File Upload, and you select Prerequisites here and Prerequisites here, and I would need to upload that results of the family and resident satisfaction survey. But once I do, I feel really good about this survey. I'm ready to submit. I'll go to the home page. I'll go to the confirmation and submission. And here I will enter in the name and the title. I'll enter in. And it'll have my email, and then I can go ahead and confirm. So you'll have to check confirmation, and then you'll hit the submit button. In this case, I've already submitted, so that's why it's grayed out. But it wouldn't be when you go in to submit for the first time. Any questions?
Folks, that kind of takes us through the whole live demo. Is that helpful for you all to see it kind of live? Do you have questions? Are there things we can go back and show you how to do? Again, if you still have questions, if it sounds good, put some thumbs up for us and things. But if there are, please use the chat or raise a hand, and we can let you unmute and be able to ask a question. If there's anything you'd like us to be able to walk through live for you, where you're like, I'm not sure how to do X or Y or Z. Okay, I mean, hopefully that's indicated we've done a really good job here and being able to show you how to navigate this portal. Not tons of changes from what you've seen in prior years, but always good to have a refresher.
All right, great. We can go back to the presentation. All right. And
I can go ahead and share there too.
Okay, great.
Thank you, Charlotte and Gretchen, for taking us through that. Are folks able to see my screen okay? On the technical guidance?
Yep, we can see it.
Great. So just a few things I just want to underscore before we wrap up today. Evidence. You'll see this word often within the measures. Evidence of events, evidence of programs, etc. When this term is used in the measure, that is saying that the requirement is the home needs to supply more than just a narrative description. What we are expecting is that the home will provide specific documentation, such as images, announcements, flyers, formal policies, sign-in sheets, or other documentation for the review team, other than just taking your word for it, right? So when we say evidence, we want to see something in addition to just a narrative, some sort of documentation of what happened, particularly around events. This is an important one, and sign-in sheets and things like that are what we're kind of looking for. So make sure you're paying attention there where it says evidence. We want to see more than just a narrative. Also, utilize the tools built into the portal. This is a requirement. There's multiple reasons why we have this. It's good for all of us. Excuse me. It's good for you all because it'll actually calculate it. You won't end up in these situations where we mix the numerator and denominator and got them backwards and look like we don't make the measure. It does a lot of calculations for you. It also makes it easy for our review team to go in and see where you've landed and see those calculations. And lastly, it provides us with discrete data. So when you're filling in data into a box like that, that allows it to get downloaded into our data information systems for us to be able to analyze the program. And then again, lastly, we've hammered this home quite a bit today, but make sure you're uploading documentation to the specific minimum requirements that you're applying for. We've had instances in the past where somebody will select measure 1, enhanced dining, and they'll select minimum requirement 1.1, and then they'll upload in a giant PDF that has all the documents for 1.1, 2, 3, 4, 5, and 6. And they might not even be in the order. And then all of a sudden our team has to go again on a treasure hunt to try to figure out which minimum requirement, which page is for, and whether you met it or not. And we almost always have instances where we'll miss something. So take the time, split those documents up, submit them for each minimum requirement. It's a little bit of an extra step there in some cases for you all, but it really ensures that the review team doesn't miss anything and we give you the credit you deserve for all the work that you're doing. Last piece we just want to make sure on for measure 24. There's no changes to this measure, but this is the behavioral health care measure. And we're going to have some updates to this measure kind of going forward for the next application, but this is still in place for this year. To earn points, you must submit the name and contact information of the individual at the regional accountable entity responsible to be a liaison between the nursing home and the RAE for behavioral health services. Just Googling Health Colorado and putting in their customer contact number will not suffice. Putting in just the referral line number will not suffice. We want you to really establish relationships here and have a conversation with someone so you understand the benefits that each Medicaid resident has from the behavioral health organization that's under the regional accountable entity. They are all paid a per member per month that covers the behavioral health services and needs for all Medicaid residents, including the ones in your home. I know you all have a lot of programs in place, but you need to understand what complementary services are available. We know budgets are tight. There's already money going to other places to make sure that these folks have services available. You need to understand what that RAE offers, what that behavioral health organization offers, what services are covered, and how they can best complement what you are doing in your home, and how you could be able to really support the behavioral health needs of all your residents and your Medicaid residents here. In order to do that, you're not going to get that from knowing a referral number or a 1-800 number. You're going to have to actually be able to find someone, because the RAE covers physical health care coordination for all Medicaid members of all ages, and they're the behavioral health organization. We want you to try to find a name and contact information. If you have trouble and if you're contacting them and that organization is not able to direct you there, reach out and we will help you be able to make those connections and those contacts. But the point of this measure is not just to check a box that I got a phone number. But we tried to make it simple in terms of reporting to us. But the intent here is that you are working to establish a relationship and your home is having a good understanding of the services and supports that are available from the regional accountable entities as the behavioral health organization. So please give us just a little bit more effort there. And then, like I said, we're going to be pivoting this measure a little bit in alignment with the emergence of the Center for Excellence in Behavioral Health and Nursing Homes. So, let us know how we can help, but really be active here. And it's not just a Google search. Key dates to be thinking about. So again, the portal opened on December 1st. We're having our training here today. The applications are due by midnight Mountain Time, February 29th, 2024. I believe with the PCG portal, that might be on Eastern Time, so don't freak out if you happen to be submitting it at 10 p.m. and it says it was midnight, or 10:30 and it says it's 12:30 on March 1st. I still highly discourage you submitting at 10:30 on February 29th. Remember, give yourself a few days just in case something goes wrong there, and we got to be able to help. We'll be completing reviews throughout the month of March. It takes us a little bit of time to get through all the applications. Then as we get into April, we will be conducting a few on-site reviews. We do this each year with about 10% of the homes who apply. And then we'll do that through April and finalize scores as well, with those scores released to you on May 1st, which will then open an appeal process where you can request for us to review and reconsider where you think maybe we've scored an error and need some clarification to be able to justify that. That's from the month of May, from May 1st to May 31st. Reach out early and often if you have questions. This isn't your only time to be able to ask questions and to have support. We're here for you every day. If you have program-related questions, don't hesitate to reach out to me. You see my contact here, Matt Haynes there, and as well as Richard Clark. Either one of us will be able to help guide you with any questions you have around expectations around the program. In terms of operational technical assistance, particularly around the portal, getting access in there, being able to use it, surveys are locked, etc. Reach out to Public Consulting Group. Best bet, you got the phone number there, but your best bet is the CO Pay for Performance at pcgus.com. And with that, that concludes the content of our training for today. We thank you all for attending. We will give ourselves another chance for any questions or comments that folks have today before we adjourn. Seeing none and hearing none, again, thank you for your time. Thank you for your participation in this program. It's a very important program. I think it's one of the best pay-for-performance programs in the country for nursing homes. It's really changing the culture of how we approach the care for our residents here in the state and highlighting all the good work that you're doing. Thank you for the work that you do every day to help folks thrive, to have the highest quality of life and quality of care, helping them to be as safe and as well and as healthy as they can be. Do the same for yourselves as well. Take care, folks. Good luck on your applications, and we'll talk to you all again real soon. Thank you so much.